Most women hear PCOS, they picture someone overweight, covered in acne, and having irregular periods, maybe even struggling with facial hair. That's the image conventional medicine gave us. But here's the truth. You can have PCOS and still be thin. You can have PCOS and still get a period every month. You can even have PCOS and still ovulate. The problem is conventional medicine only recognizes one or two versions of PCOS. So thousands of women fall through the cracks being told you're fine or it can be PCOS when something deeper is going on. If we haven't met, I'm Elena. I'm a certified nurse practitioner and an Institute of Functional Medicine certified provider. I was trained in practice over a decade in the conventional medical model. I believed in protocols, procedures, and checklists, but when my husband and I went through IVF, I realized firsthand how little curiosity there was around why we were not getting pregnant. No one stopped to ask what was driving it. That experience completely changed the way I practice, because I saw how many women just like me are pushed into fertility treatments without ever being told what's truly happening inside their bodies. There are actually more than 10 different types of PCOS, but I want to walk you through the 5 most common ones so you can finally understand why your body behaves the way it does and why fertility treatments often fail when we skip the root cause. I have a lot of patients who come to me with high AMH. A few months ago, a patient came to see me and she had AMH of 9 at the age of 30. AMH at this age should be not greater than 5. She had regular periods, so her doctor said it could not be PCOS. After 2 IUIs that went nowhere, her fertility provider recommended IVF. That's when this patient Googled functional fertility in Houston, Texas, and found me. When I looked deeper, we found insulin resistance, high DHEA, which is high androgens, cortisol disbalance. It was all there. She had what I call metabolic PCOS, not the classic kind that we see in the textbook. And when we started working together, within a few months of balancing blood sugar, supporting her adrenals, and calming inflammation, her cycles improved and she got pregnant naturally. Here's the thing, she's not the only one. I've had more than one patient with almost exact same story. High AMH, normal ovulation, multiple failed IUIs and IVF cycles, all because no one stopped to look at the underlying patterns. Once we address the root cause, the body finally starts responding. That's why I love functional medicine. PCOS is not a single clinical picture, it's a whole spectrum.